in the heart of Yorkshire. Our health service is hard at work.
Barnsley Amy, just waiting for that bed to be ready.
Your double room, your sea view.
A dedicated team working around the clock in Casualty.
Will somebody do me the next transfer, please?
Thank you, loveliness. Anything else hurting?
Yeah, my feelings.
Nice to meet you, sweetheart. It's all tapped up for you. Ask somebody else.
They're with us for our most vulnerable moments.
There you go.
You're being braver than your mum.
That tastes nice.
No, oh, bless you.
Facing life and death.
You either want to live or you don't.
Trauma and tears.
I think there's quite a chance you've broken your hip.
Supporting each other through the toughest shifts.
You're my favourite.
This is Barnsley Casualty 24/7.
I'm going to send you home.
You're far too cheerful to be an A&E.
Somebody will realise me.
I love you. I love you.
On shift tonight,
Try and breathe.
advanced nurse practitioner Cheryl Barnes,
I need you with me. A car's landed on him. He's been under the car.
registrar Dr Dan Buick,
And can we take some of these layers off?
Take them all off.
And there's another jumper underneath.
Oh my god.
Sister Jane Hawksworth,
Oh, God, I'm starving.
and Junior Dr Dean Mart.
So this is a bit of pushing, yeah? More pushing.
Yep.
You okay?
Yep.
So get ready to share a shift
This is my great-granddaughter. Do we go?
at Barnsley Casualty.
She is lovely. She's absolutely gorgeous.
At Barnsley Hospital, the team in Casualty are starting a new shift.
But I've never known 70 patients in the department at 11 o'clock.
Sister Jane's clocked on to a backlog of patients stuck in the department, waiting to be transferred elsewhere in the hospital.
You do know that I've got one on at 10.5 hours, don't you, for a bed lodge?
A lodge is a patient who's waiting in Casualty for a bed to become available on a ward.
Normally you get up to this at 5 o'clock in an afternoon.
As Sister Jane is running the hub, she must transfer the patient onto a bed within a 12-hour NHS target.
There are times where there are just simply no beds. It is difficult and it is stressful. When you're coming up to 11 hours 36, then the pressure's on to get the patients out of the department. Do you want to do a safety round if you all want to gather round? Right, so sorry it's an hour late, it's just time's just gone by without me. Currently got 18 patients waiting to go up to the ward. The issue is that there's just no beds, there's no flow. And the strategy to resolve the problem is I have no idea. The site matrons are on it. I think everybody who needs to be aware is aware. There's a lot of medical reasons why patients shouldn't spend time on a trolley. If they've got a broken hip or a broken limb, they need to be on a bed and having treatment up on the ward, which is what the wards are used to doing. Hi, it's Jane downstairs in A&E. Are you full?
With added pressure to get people through the system,
Can we get some lorazepam out, please?
Nurse Cheryl is in resus, and now that a bay has become available, she's prepping it for the next ambulance arrival. Instead, she's taken by surprise when 59-year-old Derek is brought into resus by his family.
Has it gone sideways?
Sideways.
He's been crushed when the car he was working under fell on him.
Yeah, please.
Lift your arm up for me. I'm sorry. Put it down then. It's easier. You've got pain around here?
Not around that side.
Try and breathe. So you're still really sore there as well,
Yeah,
Tummy's really sore as well. Okay.
Nurse Cheryl suspects a punctured lung or a broken breastbone.
Hello, love, it's Cheryl. I've got a patient that's had a traumatic event today, query crust sternum and pneumothorax. Will you be able to do sternal around here or not? Well, I'll just do a chest x-ray and then we'll do that one with analgesed him and that.
After calling for an urgent x-ray...
Oh, thanks, bye. Trauma team's coming down. Yeah, right. Let me just get Julian. Hold me a second.
Nurse Cheryl heads to the hub for backup.
Can you come and see this man with me in resus, please? There's a crush injury. A car's landed on him. He's been under the car. We're cannulating him currently, and it's as far as we've got. But I need you with me.
It's important that nurse practitioners and junior doctors understand when they've reached a point where they need to go and ask for help. And that's a very important part of being a doctor at any level.
Consultant Dr. Julian Humphrey arrives to help.
Derek, so this is my boss, this is Julian. Just tell him what's happened today.
I've been under the car.
Is it your own car?
Yes.
So what's it been on? A jack?
Side jack. I've got to do with a bigger jack to take weight so I can get axle stand under it.
Yeah.
Come on then.
Right. And how long were you trapped under the car for?
I've got my sensate out, but I had to force my sen out.
And once you got out, what was the first thing that you noticed about your breathing or your chest?
Pains in my chest and I couldn't breathe right.
Right,
Hurts
okay.
when I'm trying to breathe. This arm's a bit...
Feels a bit odd.
Can't get it up right.
Okay, let's have a little look at you. What about your neck? Can you move
It's
that
all right.
Yeah, my neck's all right.
And then how did you get to the hospital?
With a car from my sister.
Did you drive the car?
Now my sister fetched me.
Right, okay. Someone who is brought to the department by car and just dropped off, they haven't been packaged like an ambulance crew would package them. They come in and you have to start right from scratch, and you have to understand that you don't know what you're dealing with until you've assessed it. So the first thing we're going to do, we're going to do a chest x-ray, okay?
Yeah.
Have a look at that. Why is your pulse so fast? Are you anxious?
No, I'm struggling to breathe. It's painful when I'm breathing.
Right, it's the pain, is it?
Yeah.
Right.
With Derek struggling to breathe, it's crucial the team find out why, and fast.
Are there any beds?
In Barnsley Casualty, a lack of beds across the hospital is putting the team under intense pressure.
Let me tell the bed manager. Yeah.
Patients lodged for admission are stuck in the department.
The CDU have no discharges at the minute. They are totally blocked.
Sister Jane's running out of space. With waiting time growing for patients, she has to identify the ones who are most in need. And she's worried about an elderly patient who's not eaten since arriving at the hospital.
What is wrong with him? Benjamin, do you want a hot meal? These ladies are going to get you a hot meal. People are not very happy. It's already a very stressful time anyway because they're in accident and emergency. And I think sometimes staff are just pulled from pillar to post. Lucy, would you do me a favour, sweetheart, and just see if there's any beds around that corner? But we will never, ever move a patient out of A&E, regardless of the time that they've been in, if it is unsafe for that patient to go, because their care is the main priority.
Discharge works at this point.
With regards to the discharge unit, are they on capacity with medical beds? So they can't take anybody. All right, love. Cheers, thanks, bye.
In resus is 59-year-old Derek, who was brought into Casualty after the car he was working on collapsed onto his chest.
X-rays.
Breathe in, coming Eric. Safe. Breathe normally, hold on.
Look all right?
We'll have a look on the big one. There's no pneumothoraces I can see. Obviously it could be a sternal fracture, couldn't it, I suppose, but...
The team suspects a broken breastbone.
Trauma can be stressful to deal with. If you get sidetracked by a piece of bone sticking out of a leg, then you might miss the fact that the patient isn't breathing because they've got a catastrophic chest injury. That's why we have this systematic approach.
Straighten this arm if you can. Can you do that? It's your side, isn't it, not your arm?
Nurse Cheryl prioritises pain relief.
When somebody comes in and they're masking their pain, it's very obvious because a lot of people will be very still with pain, and that's usually quite a telltale sign that movement will be horrific for them. So the ones that are really still and really quiet are the ones I really worry about. Some pain relief on board. Sweetheart, you can have your arm now. We still need a scan, but the chest x-ray doesn't look like you've collapsed your lung or anything, so that's one thing I've eliminated. Yep. We might have fractured this sternal bone. Yeah. That's a different x-ray in the main x-ray. We'll go to when we've got your pain under control. Then we might do a CT as well. Okay, we need to make sure that everything's okay, love.
His lungs haven't collapsed, but Derek's breathing is still causing concern. And until the pain relief kicks in, he can't be moved to CT for a scan.
So to get full effect from this morphine, it's a good 20 to 30 minutes, okay?
Yeah. Probably bruised me some more out, I suppose.
Well, that kind of bruising can be quite dramatic, can't it?
Partner Caroline and Derek's cousin Steve are by his side.
How much does this car weigh then?
2 ton.
2 ton a car?
Mercedes estate.
What have you got a Mercedes estate for? What are you going to carry in it?
I've got half a dozen grandkids and a great-grandbaby.
Right, so it's going to be Grandad's taxi, is it?
Grandad's taxi.
Right. Inside you might be stressed, but on the outside you have to appear calm, not only for the patient, but for all the other people.
You got to change. Asked me to change him. So he won't mucky. He won't let me send for an ambulance. That's what he's just
Mr. Independent, aren't you?
I'm wasting resources.
Wasting resources when you've been under a car?
No, it's like
what do you think we're here for?
Just like I've said to Caroline, that ambulance where I phoned, and I'd be one that we're better off going to Wood to that
rather than somebody that had been crushed under a car. You're not going to get that with me. A lot of people, particularly sort of middle-aged upwards, are almost apologetic for being there. They don't want to be a burden to anybody, and yet quite often need prioritising because they're in so much pain.
How's your pain at the minute?
It's not too bad, it's bearable.
How would you score it now then? If 10's really severe as you came in?
About 5 now.
You sure? Only 5? We're being a bit...
Maybe a bit.
Yeah.
I've got a decent session to pay.
I think I'll need it all, to be honest, but...
If you don't tell you the truth, you know what to give, do you?
It's all right, I've sussed him out already. How's your pain now? Still bad? When you take a breath in, it's still really painful?
It's when I'm breathing mainly.
OK.
We're going to do chest and upper abdomen.
Dr. Humphrey is concerned about further internal injuries and wants the CT scan done immediately.
We're going to do a scan of your chest.
OK,
all right? Just make sure we're not missing anything.
Yeah.
So we'll pick up if you've got a fractured sternum or any ribs that we can't see.
Let me do it. You'll be pulling.
Now what can happen is if you crush your chest, you may not get fractured ribs, but you can get squashed lung, which can sort of bleed a little bit and be a bit very painful. If you fractured your sternum, that will be very painful.
Just going to CT, love, all right.
But outside Resus, more and more patients are waiting to be transferred to wards.
Excuse me. Sorry. It's like an assault course. Right, nice and slow, don't rush. You want your head on there.
That way.
Now go down on your side and then onto your back, because it's going to hurt too much if you don't. His chest killing him. I know it hurts, my darling, I'm sorry.
Derek could be facing serious internal injuries, and every minute is critical.
Oh, God, I'm starving.
In an increasingly hectic hub,
We've got 70 patients down here, obviously, and at the moment they're still coming in because we've just had a massive influx through triage, so I don't know what the best thing to do is.
Sister Jane is still battling to get lodge patients moved onto wards.
Right, so my lady, she's been in the department now for 14 hours. She's coming up to 10.5-hour lodge time.
Janie, does your staff need out or whatever? Have them managed the breaks or do you want me to fetch out?
They've all had the breaks, I've not had out yet.
Always ready to lend a hand is volunteer Jane Allen.
Just a milky coffee. Milky coffee. 1 milky coffee.
Thank you.
She can't do much about the bed shortage, but she knows when a cuppa is needed.
This is Jane's Costa coffee. It'll cost her nothing. If the doctors and nurses are really busy and they haven't had the breaks, I feel sorry for them. You can't be expected to do your very best and to perform at your best if you're hungry, thirsty, or stressed even.
Thank you.
Any sugar?
Lovely.
Might be hot, don't burn yourself.
You've got a heart of gold, you, Jane.
No problem,
Thank
darling.
you, lovely.
Also in the hub, and helping to clear the backlog of patients, is Dr. Buick.
Has anyone got a patient that can come out of a cubicle? Anyone got a patient that can come out of a cubicle? Any takers?
But the impact of today's extremely busy shift is affecting every task.
Can't find the notes, and I'm going to find the notes, can't find a room. Just going to close that, reserve that. So Gerard, you stay put. Testing my driving skills here, though.
I hope you go. No faster test.
No such test. This is high risk for you, I'm afraid.
74-year-old Jed arrived by ambulance with his wife, Barbara.
So Gerard, my name's Dan, I'm one of the doctors. Nice to meet you too. Sorry you're tucked over there, you feel a long way away.
Yeah, a bit.
Do you want me to speak up a bit? Like that? Why have you come in?
Me back.
Yeah.
But today I've just been working in garden, not out.
Yeah.
And then I just went down, pick a brick up, throw it out to it later. Just great joking back there.
Okay.
I've been in agony ever since. And then I come over, all sweaty, clammy, felt sick. And then I feel myself, I was going to pass out.
Okay. And normally, when you're well, how far can you walk? Do you have a couple of miles?
Well, yes, 2 or 3 miles depending on that, no problem.
Show off, yeah. Very good. Can I have a look at your back?
Yes.
You okay standing?
Well, soon find out.
Not be going dancing.
Do you dance normally?
No.
And can we take some of these layers off?
Take them all off. If you cut them off, cut them off.
Oh, it's an overall you've got on, isn't
Yeah,
it?
not at all. I went more layers on
You knew that was coming, didn't you?
And there's another jumper underneath that.
Oh my god. Have a feel of your spine, alright?
Yeah.
So we're getting sore there, aren't we? Okay, I'll stop. I want you to slide one down. Good. And the other. And the other. Good. And you a vegetable or flowers man?
Vegetable, she says to flowers.
He grows, I bake and cook and make things with them.
Ah, dream team. You've clearly injured the muscles of your back, haven't you? The key to getting that better is movement, okay? And obviously the key to that is getting the pain relief good enough that you can move and get things going. So I'm going to prescribe some morphine and some ibuprofen and see if that combination helps get on top of things. And once we've got on top of it, the key is to then keep on top of it. And I'll see you again, having had that, to see if your pain is better controlled, all right? And then we can make a decision together about where we go from here, if I have to admit you for more pain relief or if you'll manage with those tablets. All right?
Jed will have to wait to see if the medication gets his pain under control.
Sure.
In the hub, the team is juggling the double whammy of an influx of new cases,
Does she want it in there?
while simultaneously dealing with patients already logged into the department.
Thought that's what she said, ADC1.
And no ward spaces to move them onto.
There potentially are discharges, but it's going to be slow this afternoon.
Sister Jane updates clinical nurse manager Val Parkin.
They're getting patients out as soon as they can. I have sent one round to CDU, but their discharges are complex. It's just really, really slow.
Okay, I'll pick up with them.
In resus is Dr. Mart, who's examining the X-ray results for his next patient.
This young man, you can see the lining of the lung, and that's all air, all on the outside. So pretty much half his lung appears to be collapsed. You pop yourself down.
47-year-old Chris was rushed in by ambulance with a suspected collapsed lung, a potentially life-threatening condition.
Could you just explain to me what's been going on?
Got up this morning with almighty pain in my chest.
Yeah.
Down my arm,
Yeah.
my neck went hurting.
Yeah.
I thought I was having a stroke or heart attack.
We'll give you some pain relief through the vein. We're going to put some local anaesthetic in around the area. Find the point that we need to go in and put a fairly small gauge little tube in.
Yeah.
Drain all of that and then likely take that out tomorrow.
Yeah. What will cause this?
Well, there's a couple of things. You're skinny. Yeah?
Yeah.
Unfortunately, you smoke.
Yes.
That leads to sometimes sort of abnormalities on the lining of the lung, which could pop. So what's pretty much happened is the air leaks out and collapses that lung down, and all the way around it is air.
That's where the pain and everything coming from.
Yeah, okay. Collapsed lungs can lead to shortness of breath, chest pain, but more importantly, they can lead to compromise of your blood pressure up to a point where you might end up with a cardiac arrest. So it is critical to get sorted as quickly as you can. So Chris, that looks a bit dramatic because there's all sorts of kit coming out, but the only thing that goes into your chest is that little tube there. So the first part is just all about getting set up, yeah?
Yeah, that's fine.
Do you mind if I just figure out where we're going to go?
Right.
Once Dr. Mark fits the tube and the air is drained from Chris's chest, he should feel more comfortable.
So, are you able to rest back, hold your head in that sort of position? Right, you feel that point there?
Yes.
That's pretty much where we're going to go.
Right.
X marks the
That's a spot.
What else I need?
Lead nurse Hannah Ryan is assisting.
Yeah, you want it to stay nice and relaxed.
Yeah. It's easier said than done.
That is. Okay. Let's go.
You want the second?
Yeah. Right, big man. So the first thing you'll feel is some local anaesthetic. So it stings a bit. Help scratch. Sting, sting, sting. Lots of stinging.
The positioning of the tube is critical, or the trapped air won't be released.
All right, Christopher, this is a bit of pushing, yeah?
Yeah, carry on.
Sorry about that.
I feel a little bit strange.
A little bit sore. Sorry. You okay?
Yep.
At Barnsley Hospital, Sister Jane is halfway through one of the busiest shifts she can remember.
Well, I've only got an hour and a half doctor wait, but there's nowhere for the patients to go after the doctors have seen them. But what do we do about dinners for them?
Can we phone kitchens up and see if they can bring small sandwiches down? Because then at least it's something. We're going to have to.
Does anyone know kitchen number?
With no room on the ward, some patients are stuck in casualty. Although they've been transferred from trolleys onto beds, Sister Jane is worried some of them will be hungry.
I've got a massive capacity of patients in A&E at the minute. I've got about 85 patients in there. Some have been there for 14 hours. I need some sandwiches. And just might need some bread for some toast, yeah, for later. Thanks, sweetheart. Thanks for your help, lovey. Bye.
In resus, Dr. Mart is treating 47-year-old Chris, who was brought in with a collapsed lung.
Bit more pushing.
Yep.
All right?
Yeah. It was that first push.
Yeah.
He's performing a drain to release trapped air in Chris's chest cavity. This should allow his lung to reinflate.
So I can hear some air coming out already. Can you hear it?
Yeah, I can hear it.
So if you give us a few deep breaths, young man. Okay, good. And can you give us a few coughs as well? Okay, good man. So what's happening is the air's going in, allowing it to escape, but not allowing atmospheric air to come back in, okay? So it's pretty much a one-way seal. You just stay nice and still, yeah? Yeah, cool. You're happy?
The thin tube directs the escaping air into a water box, which prevents it from travelling back into Chris's chest.
Okay, so that couldn't have really gone any easier. You're the ideal candidate, matey. Yeah, being so skinny.
I've been this way for over 30 years. Never not changed.
So you stay nice and still, yeah? I'm just going to stick this in place. It's not stuck yet. No big movements, okay, even with this in, because although this is sticky, they sometimes come loose, and the last thing we want to do is this to fall out. Is that understood?
Yeah, that's fine.
Okay. Yeah, it will. Do me a favour. Big cough. Okay, that's fine. Good. That, sir, is that.
Do you want some paracetamol?
No.
Do you know what, Christopher?
Yeah?
I'd take it anyway, because it might get a bit sore later.
I'd take some.
Well then.
So we leave it overnight, usually. Make sure everything's okay, and then take it out tomorrow. Yeah, so
How long left stay off work?
I'll take a few days off.
Yeah.
Yeah. No scuba diving. Yeah? No skydiving or anything like that. Yeah?
There's no danger in that.
It's fine. No bungee jumping. But definitely no smoking. Yeah.
2 paracetamols and the little one's codeine.
Right.
Okay.
Oh, mate.
Chris's wife Joanne and son Alfie have arrived.
You stopping here with me tonight? You stopping with me? Why?
We'll give it a couple more minutes.
Yeah.
Just make sure everything's stable, and then we'll move you back onto the main department while you're waiting to go upstairs.
No problem.
Is that all right?
Yeah, it's fine.
See you.
Yeah.
Morning, yeah. What's it
In the
going
door.
to see there?
I don't just that.
Chris will wait to be admitted.
Okay.
See you after school, yeah?
See you later.
See you later, babe. Love you.
Until a ward bed becomes free, he's moved out of resus to recover in the main department.
Yeah, so we'll just put you in cubicle for the time being.
Have we got anywhere else for me to put this gentleman then? Because there is no corridor space. There's nowhere. That's the only reason.
Yeah, not at the minute. I'll try and find somebody. 1 minute, buddy, all right.
Busy.
You ain't seen it, what, sorry? It's busy. Yeah, definitely.
Chris's chest drain was removed the next day and he was able to go home. In the hub, Sister Jane is trying to restore order to the department.
I've got some sandwiches coming down. I've got 40 sandwiches coming down from the canteen.
But with corridors packed with patients and no ward beds for them to go to, getting them fed has become an urgent priority. Emergency sandwiches have arrived from the canteen, and auxiliary nurse Mike Theodore is sharing them out.
Hello, hiya. So we've got ham, egg mayonnaise, cheese, or chicken and mayo. Chicken mayo? Yep. All right. Want to try a sandwich? No. You sure? Yeah.
Here, I'll have a toasted one.
Anything in brown? Tuna mayo in brown. All right. No worries, lovey.
Thank you very much.
In radiology, 59-year-old Derek has had an urgent CT scan.
Right then, let's press this button on the wall.
He was working underneath his car when it slipped off the jack and crushed his chest.
Right then.
Dr. Humphrey is looking at the initial results.
That's a nice chest, that's just exactly. They're not really come through yet, have they?
No. She said she'd do it straight away.
Give her a chance.
Yeah.
Right, treat the patient, not the scan.
Yep.
Okay there?
Yep.
Breathing a bit easier now you've had that pain.
Bit easier there.
You're not breathing very deeply because it hurts.
It hurts.
So we're going to give you a little bit of oxygen, okay?
Yeah.
We're just waiting for your scan report.
Right, this just pops in your nose, Derek. It's a bit weird. Around your ears. So what's that pain like now?
Got a bit sharp again.
Okay, right, some pain relief.
Moving about.
Yeah, more morphine.
A little bit more, are you all
Drop me
right?
up a bit.
Yeah.
While the team waits for Derek's pain relief to take effect,
Can you have an airway, please? Cardiac arrest.
a heart attack patient is being rushed in.
Round the bottom of the stairs.
Where are we going? Here.
The team needs urgent access to specialist equipment in Derek's resus bay.
Take the airway.
I can take the airway to start with. Do you want to just fast break the anaesthetists?
So he's moved into the paediatric bay.
Sorry, we had to move you.
That poor person that wanted to be in that bay needed to be in one of me, didn't they? So.
But Derek still needs to be in resus as well.
How are you doing?
Still sore like, but it's just when I'm, when I'm trying to fill my lungs up. That's when it's painful.
Take a breath.
Yeah.
He's still struggling to breathe.
Can you two just go and pull the bed round?
In the hub, discharges from other departments means Sister Jane can finally move some patients out of the casualty corridors.
Right, there's 5 patients now that can go to the ward. 3 for AMU and 2 for 31.
Dr. Buick's heading across the hub to cubicle 4 to see 74-year-old Jed, who's injured his back.
Come on then, let's get you standing.
He's taken painkillers half an hour ago, but he'll have to prove to Dr. Buick that he can keep moving if he wants to go home.
Do you want to try a gentle walk? I'm aware I'm being mean, I'm doing it on purpose. For your own good and all that.
Yeah, I know.
Come on. Do a lap for me. Come back to the room. Stop if you need a break. Have a moment if you need to, there's no rush. How's that?
It wasn't about 3/4 way, but then when I got to that corner, it was a rest.
You're not going to suddenly be able to, you know, do tons, but it's about trying to keep things as mobile as possible. I'm keen to get you home because that's where you're going to mobilise the most. I'm going to give you that prescription. So tonight, codeine, paracetamol, ibuprofen.
Would like to be on these long term?
No, it's only a 1 week. I don't want you on those long term. It's only for a short period of time. All right, lovely.
With Dr. Buick's pain test passed, Jed and Barbara can head home. Jed is still recovering and doing his exercises while taking a break from gardening. In resus, the team are working hard to get Derek's pain under control.
How's your pain at the minute?
Not too bad. It's worse when I'm breathing. You know, when I'm breathing now. That's mainly when pain's in it.
He arrived in agony with suspected internal injuries after a jacked-up car collapsed onto his chest.
Thank you.
Right,
Nurse Cheryl's got news for him.
Right, Derek. So the CT report's come back, and you've not fractured anything that we can see. It says no acute injury.
Yeah.
Incredibly lucky.
Yeah.
I cannot believe there's no injuries on that CT scan.
Very good stuff. I'm from good stock.
You are, love. You're a good old Barnsley man, aren't you? The problem is when you've got crushing injuries like this, the breathing and that can deteriorate unless you get really good pain relief.
Yeah.
Okay. And it's classic that you end up with a pneumonia when you don't deep breathe.
Right, yeah.
So I'm going to keep hold of you today.
Yeah.
And tonight.
Yeah, that's fine, yeah.
And then see how you are in the morning.
No problem.
Just waiting for the bed to be ready.
Yeah.
Bear with us.
OK, I'll tell my missus to organise up neat way.
There are patients that really get under your skin. You go home and you're thinking about them and hoping that things have improved for them.
Oh, here we are, my little. This is my little. Look at this. This is my great-granddaughter, 2-week old.
Oh, wow. What's her name?
Nevaeh.
Nevaeh. Not heard that before. So she's the reason for your taxi then? She is lovely. She's absolutely gorgeous. Right, if you need anything, let me know.
Yeah, thank
okay,
you, Cheryl.
no problem, mate.
Ah, my little darling. Hey, my little darling. Yeah, my little chicken, how you doing? Eh? You got a bit of wind? Or are you going to the toilet? Oh. What doing? Oh! Yeah.
In a bit.
Yeah. All right. You got it.
Carrying Charlie.
Yeah, I'll order you.
I'll see you later on then.
I'm going to go out later anyway.
Ah, you right, I'm all right.
Derek's at a high risk of developing pneumonia because he's not breathing deeply enough.
Right, sweetheart, see you later.
So it's crucial his pain levels are brought under control quickly. In the hub of Barnsley Casualty, Sister Jane is still focused on keeping patients moving.
Hi, love, it's Jane downstairs in A&E. I've got a lady for you.
While Junior Dr. George Kay studies the head scan of his next patient. But with people still queuing in the corridors, his biggest challenge is finding her.
She's not where she's meant to be. Corridor. No. Hello. 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 What's your name? Nice to meet you. My name's George. I'm one of the doctors. I've just come to see you, if that's all right.
Yes.
There's a room just over there that's free. You're all right on your feet?
No, I usually walk with a walking stick or a walking frame. I'll try anyway.
So you just take your time. All right.
84-year-old Alice had a nasty fall at home. Son Ian is worried she may have head injuries.
Come in, come and have a seat on the chair for us, all right? You've done really well. Right, so tell me more about the fall, so I've got it in my head.
I was on landing. I come out to the bedroom and I fell backwards.
Okay.
And I caught shoulder with back of my head and I felt dizzy.
Does anywhere else hurt at all?
It went back in my head and the shoulder.
And the shoulder as well, fine. And we don't think you're blacked out at all or anything like that? No. And I think you've already been round for a scan of your head, haven't you?
Yes.
Yeah. Fine. So that scan was all normal, which is good. So what we're going to do, if it's all right with you, is have a little listen to your breathing, have a little listen to your heart as well, and then quickly have a little look at that shoulder and the back of your head and everything. Is that okay? So can I borrow your hands? Is that all right? I bet you're desperate to go home, aren't you? I'm just going to have a little listen to your heart at the front. And if you just sit forward for me, I'm just going to have a little listen to your lungs at the back. Is that okay? And then while I've got you sat forward, I'm just going to have a little feel all the way down your back and make sure we're not missing anything. And you just let me know if it's sore anywhere. Is that all okay?
Yes, yeah. Oh, that shoulder there.
Round here.
Shoulder blade.
And then can you have a little look at my nose there? Which hand's moving? And which hand's moving? Which one? Which one? Can you see this one down here?
Yeah.
You're not saying both of them.
I'm saying both of them either.
Oh, well, I didn't know you wanted both.
Can you, if you look here, can you definitely see this one moving down here?
Yes.
And then can you stick your tongue out for me? Good. And then close your eyes really tight. Good. And then can you puff your cheeks out for me? Perfect. And then can you squeeze my fingers really tight? Really tight. Perfect. And relax. And can you move your arm behind your back like that for me? Perfect. I think we can get away with not x-raying that shoulder, can't we? I think you passed all the tests with flying colours. Before I do let you escape, I'm just going to take that blood pressure, all right? Are you able to stand up for me? Is that okay?
Alice's blood pressure needs to be checked while she's standing to eliminate the possibility that it drops when she gets on her feet, which can cause fainting.
I know I'm a nuisance, aren't I?
Oh, yeah, you're all right.
You're all right. What's the matter?
I'm dead scared of falling over.
Okay. Well, we'll just do the one then, all right? Yeah. Perfect, that's all fine. All right?
Yes.
So let me grab this wheelchair for you, all right? And then we'll let you escape. I can't find any at the moment, but I bumped into one of the porters, and they're going to see if they can find one in their secret stash. Okay, so they're going to come here and get you a wheelchair, all right? I've let them know where you are. Okay, so hopefully it won't be too much longer for you. Is that all right?
After recovering at home, Alice is now adjusting to a new walking frame.
Right, does either you or Michael want to go? I need one of you to just go.
In the hub, even though they're at full stretch, Sister Jane wants to make sure the team all get a break.
We are an amazing team and we will pull together at the worst times possible. But we're human and, you know, we need fuel to keep going. Not one of them would ever think, well, I'm going to go off and get a cup of tea, or I haven't had my break. So who's going?
Shelley's going.
Shelley's going and Lucy's going.
With the staff getting their breaks, volunteer Jane can turn her attention back to the patients.
I'll sort it out for you, sure. Well, thank you very much. I would clean up after myself, but seeing as you've offered, thank you very much.
Yeah, my love, there's drinks here.
I think part of my job is to try and make people feel a little bit more at ease, give a bit of a laugh, etc., wherever it's appropriate.
We could make it into a big television screen. Jane TV.
Go on, I best get on now.
All right, love. Yeah, they are, love, yes.
In Resus, Sister Zoe Midgley takes Derek to the clinical decisions unit for overnight observation. He's at risk of developing pneumonia because he's unable to breathe deeply enough after his chest was crushed when his car fell on him.
I'm sure you're all right.
Yeah. Ben, and they're topping up a bit when you're ready, when you've died.
How do you take your tea?
No sugar.
No sugar. Do you want a biscuit to go eat?
If you don't mind, love, please.
Have you had something to eat today?
No.
Would you like a sandwich?
If you don't mind, yes, love, please.
No
anything.
problem.
After getting Derek's pain under control, he was discharged the next day, but it will take up to 8 weeks for him to heal fully.
Now, Flower, your cup of tea.
Thank you.
So we've got a right lot of choice.
He's continued to work on the car himself.
Cheese, please. Thank you.
But now, he's taking extra care.
Where's your patient? I've just got a cancer patient. 3. We can go into 3 then. Everybody has been fed and watered.
Sister Jane has been keeping things moving as best she can all day.
They've just pulled his bed so he can go. He should be copied.
As her shift comes to an end, she hands over to Sister Zoe.
So there's going to be no bed CDU.
They will have a mail shortly. All the discharges that they've got are complex ones, so social services and things like that.
Sister Jane and the team have had one of the busiest days she can remember.
We're very short on cups. Don't throw it away.
Keep hold of your cups, everybody.
You do think about the patients that you leave behind, but they're no worse off because we've gone home, because it is another team of excellent nurses who have come to take over from us. We are generally a lovely hospital who will help each other out at times of need.
With the next shift at the helm, Sister Jane and the team head home. Next time on Casualty 24/7.
Can't find patients, can't find nerds, can't find doctors. Can find nurses though.
How are you feeling?
Fed up.
What, because you're here?
Yes.
Yeah. Come on, open your mouth, mate.
Nasty break right across there.
Great, okay.
That's next Wednesday at 9 as brand new Casualty 24/7 continues. New tomorrow at 9, it's one of Alex's biggest makeovers to date. The Duke's, a picture-perfect Bedfordshire thatch pub that's far from picture-perfect on the inside in the Hotel Inspector. Next tonight, we're back with the medics on a pressurised night shift that sees a 92-year-old with a possible bleed to the brain in A&E After Dark.